Well, hello, everybody, and welcome to Healing Arts London. And the question for today's panel is, does art heal? We want to talk about the evidence and we want to talk about the policy. And we have an incredible panel. Now, because there are lots of people on here, I think I'm going to introduce them one by one. So and then they're going to say their bit, so you know exactly who's talking. Really, I'm just going to say a couple of words to start about my interest in the area, and then I'm going to hand over to Chris Bailey. I should say I did used to work for the World Health Organization as an epidemic early warning officer, which is now quite a fashionable job, and I think now everyone understands the importance of it. But most of what I do now is I make television programs for the BBC, and a lot of them are kind of eat your greens television programs. I tell people to drink less, lose weight, eat healthily, and so on. And all of that is very valuable. But I do one program that deviates from that, which is a program for children on CBBC called Operation Ouch. It's my favorite thing to make. And I think it's because it's quite subversive and there's almost no eat your greens in it. You might imagine that getting kids a message about treating their bodies well and being healthy would be really important early in life, and no doubt it is. But in fact, what we do is we show injuries, we show illness, we do experiments on the bodies, and we lay it out for them. We don't put any emotional interpretation on it beyond enthusiasm and curiosity, and we allow them to interpret what they're seeing. And so we have grossness, we have disturbing images, and the best feedback we get about the show is not that children are healthier for watching it, although we hope they are, but instead that they are better at being patients, they're better at being ill, and they're better at understanding the people around them who they love and care about who are ill. And that seems to me to be perhaps some of the value of what we're talking about today. In the ineffable, in things that require interpretation, there is the possibility of exploring things in ways that we can learn far more than just kind of didactic advice from healthcare professionals. So I hope we're going to, over the next 90 minutes, we will be able to kind of explore the vast range of possibility that art offers us. And I hope we're going to get into the intersection between arts, politics, and the balance between the evidence and policy and that ineffable nature of art. And we do have an incredible artist with us who I hope is gonna really drive that home and talk about that. So we're going to start with Chris Bailey. We're incredibly lucky to have Chris Bailey on the panel, or at least I am, because it means that I don't have to say too much, because he is simply one of the most articulate, clear, welcoming, inviting people we could possibly have to talk about these two mighty beasts, health and art, which can be so intimidating and confusing for people. He's a hard man to introduce, but briefly, he's the arts and health lead of the World Health Organization, which is obviously based in Geneva. He's based in Geneva. And this is a newly established program. His newly established program is looking at the research agenda and the health benefits of the arts. He was educated at Columbia and then at Oxford, but he's also an actor, he's a playwright, and he's unbelievably thoughtful. And if you didn't see him talking in conversation with Gillian Anderson on Monday, I think I would advise anyone to go and look at that as a tour de force in describing what it is like to have a changing experience of the world and of art itself as he lost his eyesight. So Chris, I hope I can hand over to you now, and it would be lovely if you can introduce this mighty topic and kick the panel off.
Well, thanks a lot, Zand. I don't quite know how to react to that wonderful introduction, but you did leave out what a good cook I am. So I just needed to mention that as well.
I haven't tasted the food. I can't speak to that.
Oh, okay. Yeah, and I'm only going to speak for a few minutes because I, like everyone else, am very much interested in the answer to this question, does art heal? And it's the panelists who will help us explore that. I'm as anxious and excited as you or anyone else to hear what they have to say. And normally when the two of us start talking, it becomes an hour or two conversation. So I'm going to restrain myself just for a minute or two. I think if I have to look at my role as the arts and health lead at WHO, what I really am is a translator between two worlds. Because when you go to the health scientists and you start talking about art, they immediately freeze up and think anecdote and unobjectivity, and they get nervous. And then when I go to the artists and I start talking about the importance of science and looking at science and looking at art through a scientific lens, they'll say, why? Why do we have to measure it? I know when it works or not. I can feel it. I can feel the reaction in me. I can feel the reaction in the audience. And I think one of the opportunities we have in this pandemic is that it's become abundantly clear to everyone why this intersection is so important. We know what it's like, particularly at the beginning of the pandemic, when we had so little reliable information that people were desperate to get the facts. And that's what science can provide. And that's incredibly important. But more than just a yearning for facts, people want meaning. And meaning is what the arts can provide. And it's that combination that creates knowledge. And that's something that I think is much more easier to feel, because we've seen the results of it over the last year. And we've seen the spontaneous outpouring from the artistic communities, whether it's been pop-up concerts or on Swiss radio this morning on RTS, I heard a story about a doctor in Lausanne who hired a bunch of professional poets. So as she and her team go in to care for people in intensive care, in addition to the technical information that they are exchanging, she hands a personalized poem to their situation. And she talked about what an effect that had. It was marvelous. All of us know personally now what it's like to be confined, to be constrained. And yesterday, we had a wonderful session on how artists manage in a situation of confinement. And it reminds me a little bit of that Wordsworth poem, "Nuns fret not at their convent's narrow cell." When we find ourselves confined, is that a prison? Or can we, with our imagination, turn it into a womb? And that's a question. But all of these examples that are popping up that intuitively we feel, there's a there. At WHO, we believe that data is not the plural of anecdote. We don't believe much in magical thinking. We believe that the scientific method and evidence is the path to understanding what is actually happening. And so the question is, what is the state of that evidence? Can we look at it? What does that mean for policy? And when we start looking at the arts, what is the role that it plays? And I can see why some people might think, art doesn't really heal anything. And certainly, if you define health as just merely having an illness, then that might well be true. I mean, I'm not going to look at a painting and have my cancer cured. But if we define health the way WHO defines health, as not merely being the absence of disease, but the attainment of the highest level of physical, mental, and social well-being, then art does have, I would imagine, a role to play. But the question here is, what is the evidence for that? If we heard yesterday about hospital rooms having murals on the wall, that feels right, but is there a way of measuring that? Can you measure the cortisol levels in the staff and the patients and see if that has an effect on stress? And does that affect the rate of recovery or healing? It's that kind of thing where we can get into the details and begin to see some indications of whether it's more than just a feeling, whether it's something that actually is measurable. And so that's the adventure we're going to go on today.
Chris, that is a brilliant introduction. You remind me of William Carlos Williams, who's a poet and doctor, and the quote from his poem Asphodel, where he said, "You cannot get the news from poetry, but men die miserably every day for lack of what is found there." So you've teed us up perfectly.
That's right.
The The next person I want to introduce is Dr. Dévora Kestel. I have to say, for me, interrupting or hassling along someone who is the WHO lead for mental health and substance use is intimidating. The panel is going to be, everyone on the panel is going to have to constrain their remarks, so I will try and prod everyone along if it's running too long. But anyway, I just thought I'd say that up front because I know that I won't really be willing to interrupt later on. Dr. Kestel is, as I say, responsible for WHO mental health and substance use. Initially studying psychology in her native country of Argentina, she went to work in the field of mental health for 10 years in Italy. She then joined the World Health Organization's office in Kosovo. And then prior to getting her current appointment, she was unit chief in mental health at PAHO, the Pan American Health Organization. She is sitting with this spectacular background of flags in a room full of empty chairs. I can't think of a more sort of poignant and wonderful situation for you to have displayed yourself in. And so she's going to talk about the background, the global picture of mental health in the world. I mean, no one could be better qualified to talk about than this, pre and during COVID and the World Health Organization's overarching strategy. Dévora, over to you.
Thank you, Alex. And I thought that the colors of the flags was bringing a bit of more interesting background to us. I'm going to share a few slides. I hope you don't mind, and tell me if you see it. I'm here to bring one part of the information from one of the perspectives that Chris mentioned, maybe not the funniest one, but still a useful one. That is, what do we do? What do we say it is? What needs to be done also by countries? And so the idea of mental health and well-being as a component of WHO definition of health that Chris just mentioned gives us the framework, right, that we need to work on mental health in WHO. And we have, you see here in the slide, the global strategy for mental health that guides the work that we do and is responding to countries' demand to WHO to support the work that they do at the end of the day. And in this context is that we also have the possibility to answer to Dr. Tedros' decision to identify mental health as a flagship when he came on board. So we developed a specific program that is the Special Initiative for Mental Health, that it means universal health coverage for mental health, in a way to strengthen the work of the Global Action Plan and to make sure that promotion of mental health and prevention and care and services and information and research, everything that people need in a country when they have mental health challenges is included in the health system, and it is part of the health system. So then we had a situation that was already a big burden of mental health. We have just two numbers or three for you to avoid being too boring, but 1 billion people suffering from mental health conditions, 1 billion people suffering from mental health conditions, 1 person dying by suicide every 40 seconds. But also we know that around 2% of the health budget goes to mental health. So to answer to the needs of that billion people, of those relatives and friends and the network of those dying by suicide, to prevent more death by suicide, all countries have is a very small budget. And as a result, around 70–80% of people with those conditions in low and middle income countries do not receive any care. So to this not very happy network, COVID comes with a number of challenges that were mentioned earlier also by Chris, right? The infection, the COVID-19 infection comes with some mental and neurological manifestations. We don't name them now because we don't have the time, but there are some manifestations that are typically happening in the context of COVID that belong to this area of mental and neurological issues. Then we have that we all went through, the anxiety, the feelings of helplessness, the lack of information that was mentioned also, the uncertainty of what's coming, death of loved ones, challenges of every kind for different vulnerable groups or groups that became vulnerable because of the COVID. The situation worsening for those with already mental health conditions. So all of that in a situation that was already weak did not help much. The services were disrupted, and lack of answers during the first round, I would say, phase of COVID-19 were clear. But then everybody has been working. Countries have found, identified alternatives and things that could be done to respond to those needs. And we, from our side, tried to produce in the recognition that mental health and psychosocial issues are very important in the current situation. We came up with cross-cutting issues and products that will answer, on one hand, to the needs of the general public, but also, on the other hand, to the specific needs of health practitioners as well as mental health specialists. And so here is where, sorry, I went too fast. Here is where maybe a bit of art came to this boring picture, and is that we engage on for example, last year on the World Mental Health Day, October 10th, we brought together actors, filmmakers, musicians, illustrators, and a host of other artists to produce the first ever global mental health advocacy event of its kind that was called the Big Event for Mental Health, and including footage from over 30 countries representing what is happening and what is being done in the context of mental health, but also in the specific context of the pandemic. And a bit more of the work that we do then in collaboration with partners is how we used art and the creative tools to communicate with the audience that we work for. I mean, on one hand, we have tools developed with emphasis on stress management and how we used arts as a medium for this, to convey this important communication. And so we have here an example of doing what matters in times of stress, is like artistic illustrations to reduce the text and to get faster to the messages and the tools to deal with stress. We have then here basic psychological skills, that is to provide key skills to first responders to COVID-19, so that they will know how to manage their own psychosocial issues and the one of the people they work with. And again, using with the example of Where's Wally, we changed that into specific technical issues that were needed. We have one for elderly population. And the last one that I want to use here as an example is My Hero Is You, that you see here on the corner, is a children's storybook on COVID-19, which uses storytelling and virtual arts to engage with children and families while sharing information and skills on how to cope with COVID-19 and the related stressors. And the book has been very successful. It has been translated in 137, I think, languages, and it has been used in a number of creative artistic ways to whether they are theater piece or movies or adaptation to indigenous communities in different regions of the world. And it is a real example of how art could serve the purpose of getting better to people needs and also potential solutions. And then to finalize, what we are trying to say is in each of these examples is to show how these illustrations and storytelling and imagination and creativity were central to creating products that are engaging and entertaining, but which are also offering a message that should lead to better mental health and well-being for all people over the world. So to conclude, we are pleased to see and to encourage this focus on creative activities and art, because as it was mentioned before, in line with the WHO definition of mental health, engagement in artistic activities directly contributes to a sense of community and is a healthy way to coping with the many challenges that people have, and to be able to enjoy life and promote their own well-being and the well-being of others for all of us. So thank you, and over to you for the time being.
Dévora, I don't know how you managed to do that so rapidly and so brilliantly. Thank you very much indeed. And you, of course, you raise, as the World Health Organization must, the sort of the issue of the transcendental nature of art, of its universalism, and yet it is also something that is highly specific, highly grounded very often in a particular location. So I hope we're going to pick up on some of those things, the huge range of value that you've just described so well. I'm going to keep moving on, because I'm also toggling to the YouTube screen and I can see your comments and your questions coming in. We've got people tuning in from literally all over the world, which is brilliant to see. So I'm on there. I'm on there, and I'll try and message people, but I will be looking for those, and we'll be putting your remarks to the panel. The next panelist you can see is Daisy Fancourt, who is clearly Dr. Daisy Fancourt, who is clearly a professional, because she has sensibly arranged her art so that its slight skew-ifness doesn't trouble you, unlike mine, which I think will gradually be beginning to frustrate people throughout the talk. Daisy is really an extraordinary person. She is an associate professor of psychobiology and epidemiology at University College London, and she's a Wellcome Research Fellow in the psychobiology group at UCL. She studied at Oxford and at King's before doing a PhD in psychoneuroimmunology. That's 3 disciplines, so you know it's complicated. And now her research really focuses on a huge range of social factors on health, loneliness, social isolation, community assets. And I interviewed her for a television program last year and was really struck by someone who, as well as having an enormous depth of academic work, is passionately and enthusiastically pursuing the value of the arts. We talked more the stuff that wasn't in the interview about choirs and about the benefits of singing and all these things. So she really does have a breadth of learning and of wisdom. During the COVID-19 pandemic, she's been running a team doing the UK's largest study into the psychological and social impact of the pandemic. She's been providing weekly data to government, the World Health Organization. Loads of organizations have found this exceptionally valuable. And as well as that, she's worked for a long time in the NHS, looking at the ways in which arts interventions can improve care pathways. So, Daisy, I hope you are the lead author of the World Health Organization's report on the evidence base of the health benefits of the arts, which again is like literally there's sort of no one better in the world to address this question than you. So I'm hoping you're going to talk to us about the state of the evidence, what it tells us about health and the arts, and what it doesn't tell us.
Thank you so much for that lovely introduction, Zams. It's a pleasure to be speaking today, and it's also a great pleasure to have spent the last few years working with WHO to explore the breadth and depth of the evidence base on arts, culture, health, and heritage, and trying to get to grips with the global role that the arts can play in supporting health and well-being. And from this scoping that we've done, several things have become clear. First of all, there is an enormous body of literature from studies carried out internationally, with over 3,500 peer-reviewed studies included in our reports, not to mention a huge amount of grey literature. Second, the ways that the arts have been shown to affect health are incredibly broad-ranging. So people most commonly think about arts and health as meaning the role of the arts in treating or managing mental and physical health conditions. So things like mental illness, neurodevelopmental and neurological disorders, non-communicable diseases, as well as the role that the arts can play in supporting the delivery of acute care and palliative care. But there's also a really sizable literature showing the role of the arts in the prevention of ill health and in broader aspects of health promotion. So for example, how the arts can affect social determinants of health, how they can support child development, encourage health promoting behaviours, the role of the arts in health communication, including in epidemics such as COVID, as you heard from Dévora, and also the role of the arts in helping to prevent the development of mental and physical illness in the first place, and also in supporting formal and informal caregiving. But the other thing that's really come through is that this research is now being put into practice in countries all around the world. And there are fantastic case studies of evidence-based practice from every single continent. And I'm not going to talk about these now because we're going to hear some more examples of this later on in this panel session. But as with all areas of science, we can't just relax and assume that this evidence therefore proves that the arts can affect our health and that our job is therefore done. In fact, I think it's really far from it, because there are a lot of areas that we need to consider carefully as future priorities within research. So one of them is that arts and health have typically been considered as kind of start and end points, arts and health, and we assume there's a link between them. But we need to understand much more about what that link is and how it works. So what is it about the arts that mean they have the potential to affect health? What are the active ingredients that they contain? How do these ingredients align or differ from other health promoting activities? So things like physical activity, psychological therapies, other occupations. At UCL, we're actually just finishing a project mapping these ingredients, and it's really showing the complexity of the arts as activities. We also have to think about how these ingredients can trigger different mechanisms, whether psychological, biological, social, or behavioral, that can link to health outcomes. And in fact, I recently published a paper in the Lancet Psychiatry with some of my team, where we identified over 600 mechanisms that can explain this link between the arts and health. And these come from diverse disciplines, so things from psychology, biology, ecology, occupational therapy, medicine, philosophy. And we have to understand these mechanisms more and how they interact, so that we can see how they differ for different types of arts activities and for different populations. And really, this will allow us to understand what factors moderate how the arts affect us and who is most affected. We often say that the arts are complex interventions, but we need to move beyond this as being a mere label and start to understand how that complexity actually operates in practice and how we can capture it in our research. We've also got some progress to make in terms of the research that we do. You know, research is constantly evolving. And when we looked at the collective body of evidence in this field, there are some topics that are really well researched, with dozens of clinical trials enriched with qualitative studies, ethnographies, laboratory experiments, epidemiological analyses. But there are other topics that have had just 1 or 2 preliminary studies. And we need to even this playing field, both across the health outcomes that we study, but also across the types of arts activities that receive our attention. Because it's really only with this breadth of inquiry that we'll understand this link between arts as a collective and health much better. But fortunately, we've got research tools that are constantly evolving, and there are cutting edge methods that we're applying all the time now, from imaging to physiological monitoring, psychological testing, biological analyses, creative methods. So we need to maintain this cutting edge approach and really make the most of how inherently interdisciplinary this field is. And finally, and I think most importantly, we have to understand how arts activities work, not just in research settings, but also in the real world. We need more process evaluations and studies of implementation so that we can understand what makes an arts activity or an arts program successful and sustainable. We need to learn better how we can scale programs so they reach more people, but at the same time, they stay appropriate and tailored to their local environments. And we also need to continue researching the economic impact of investment in the arts, both for art's sake, but also specific arts programs for health outcomes. And we need to make sure that our research keeps telling us how we build the infrastructure in this field, how we engage hard to reach groups, how we train practitioners and health professionals and creative professionals, how we sustain the community assets that the arts rely on, how we engage with health and social care sectors, and how we communicate this field of work with the public. So I think to conclude, we have a phenomenal platform to work from, but really the most exciting work is yet to come, because it's in the detail that I think we have the potential to learn the most about what's really a very remarkable relationship between arts and health.
Daisy, you're absolutely brilliant. And I think anyone who maybe felt that a scientific view would be somehow sterilizing or ruining the slightly intangible, joyful nature of art, I feel like you've made an incredible case for the fascinating detail, and in fact, rendering everything more clearly can only add value and make these things more fascinating. I love the idea of the triggering mechanisms and the mechanisms of action, as though as though there's a sort of pharmacological basis. So thank you very much for clarifying that so nicely. We're going to move on to Professor Helen Chatterjee. My bias is that I think everyone should be an anthropologist, and working in health and healthcare for 2 decades, I just wish there was an anthropologist at my side every minute of every day. Helen is a professor of biology in the Division of Biosciences, School of Life and Medical Sciences at UCL, but she has an MSc in paleoanthropology from the University of Sheffield, which is why I brought that up. She did a BSc in environmental sciences, and then since moved to UCL in 1996 to undertake her PhD, and then took up the role of curator at the Grant Museum of Zoology, which is one of the most fabulous places. So Helen stayed at the Grant Museum for 10 years, continues to remain actively involved with the museums. And as well as her research, she's involved in teaching, supervising doctoral students, delivering strategic initiatives. She has an MBE for services to higher education and culture. And what I hope that Helen's going to talk about today is her call for data on arts-based interventions during the pandemic in the UK, and what we're seeing, what the emerging patterns are. So Helen, it would be wonderful. You've hung your pictures much straighter than me, which is instantly pleasing to see. So Helen, over to you.
Thank you, Dr. Zand. Lovely to be here, and I'm really looking forward to hearing from others. Yeah, so we've been doing research really around the role of arts, particularly in how it's been used to support people who are coming from different perspectives and different inequalities. And what we know is that the COVID-19 pandemic has adversely and disproportionately impacted vulnerable members of society. So those who have physical, psychological, or socioeconomic vulnerabilities are more likely to be experiencing inequities. And as a result, the vulnerable groups we know are entering the pandemic from differing and uneven starting points. So put simply, the pandemic is significantly worse for poorer people living in asset-poor areas. And this is linked to these widely known social determinants of health that Daisy just talked about. So it's against this backdrop that we began Community COVID, which is an Arts and Humanities Research Council funded project formed from a consortium of academics, including Daisy and others. Really importantly, people with lived experience, along with colleagues from Arts Council England, Voluntary Arts, Natural England, the Culture, Health and Wellbeing Alliance, NHS Personalised Care, and the National Academy for Social Prescribing. And what we're interested in is really trying to understand how participants experiencing lockdown, self-isolation, those who are vulnerable, those who are shielding, how they're engaging with community assets and resources. What we want to understand is what works best for the most disadvantaged members of society, how and why. And critically, we want to understand how best to support these particular audiences. So to do this, we've been running lots of surveys, workshops and focus groups to better understand participant needs and, importantly, how providers have been responding to the pandemic. So this has involved lots of discussions with a wide range of providers, museums, artists, nature connectors, community workers, social prescribing link workers, healthcare professionals, and importantly, people with lived experience. And what we've identified is literally hundreds and hundreds of resources, activities and programs which are designed to support people during lockdown, both on and offline. Some are adaptations of existing programs, but many are new programs. And data from multiple sources is showing that people are participating in activities, both on and offline, much more often now than before the COVID pandemic, which I think is really good news for arts and culture. We found a really strong correlation of loneliness and psychological well-being. We use the 3-item loneliness scale. Others have been using ONS, and Daisy, and if you have a look at her study, they've also been using lots of different metrics for looking at loneliness and measures of psychological well-being. And all these studies are showing the same thing. As loneliness decreases, well-being increases. We found that respondents who did not feel at all connected to others have the highest loneliness scores, which is what you might predict. So we know that social connection is the most important issue that we need to try and tackle. And what we've been seeing is that increases in well-being have been directly associated with the extent to which people have been feeling connected to each other. Hence, the more connected they feel, the higher their well-being. And we specifically found that well-being and happiness scores were slightly higher for respondents who have been participating online with other people. So this is giving us some really great insights into what's working. For example, creating an online community of practice and opportunities for sharing and connecting with others is really key, perhaps less so than what you actually do. Also, having a really experienced facilitator is key and really helps, and having opportunities to engage both on and offline, ideally a combination of the two within a program, seems to work really well. But really importantly, having creativity built into the heart of those activities. And a key feature of what we've been finding is the value of developing what we might call creative health partnerships, which harness the collective power of arts, nature, and other sorts of community building assets in collaboration with health, social care, and voluntary third sector services. And in some cases, this has led to new and unexpected collaborations, such as museums, libraries, or artists working, say, with food banks or local authority risk registers. And this has created really great new ways of working to support vulnerable, marginalised or isolated members of communities. But despite providers reporting to us that they've been doing much more outreach work to target people from disadvantaged backgrounds or vulnerable backgrounds, many feel that there are significant barriers to participation for vulnerable and shielding individuals. And this includes things like difficulties in finding out what's available in their community and a lack of support in accessing resources that are available. So I think these are really, really important lessons that we need to learn and think about how we take forward. So just to conclude, what's become really apparent is the fragility of this community ecosystem. We've seen a really fantastic response from arts, cultural and community sector organisations, but many of these organisations are facing an uncertain financial future. Arts organisations have had to be really agile and adapt their offers very, very rapidly. The pandemic has therefore favoured organisations who, irrespective of size and financial income, can adapt swiftly and have a deep understanding of their audience needs. To date, our research is shedding new light on how creative and community engagement can be used to tackle some of the major social determinants of health, such as isolation, digital poverty and inequalities. And it's given us a better understanding of how arts, creativity, nature and other community assets can be better deployed to tackle health inequalities. But I think there's still a long way to go to understand how to make all of this great work available to all of those who face the worst inequalities. In other words, how can we make this community ecosystem fairer and more equitable for all? And soon you're going to be hearing about the work of the National Centre for Creative Health, and we hope this is one route for us to help realise this ambition. So thanks for having me, and back to you, Dr. Zand.
Helen, that's brilliant. Sorry, hang on a minute. I'm toggling between YouTube and Zoom. Here I am. I'm back in the right place. Look, thank you very much. I mean, it's so extraordinary to hear, to go from the massive scope of this conversation into the detail of considering the value of a food bank in combination with a museum, for instance, the extremely vulnerable people. And I think there is perhaps a sense among some of the healthcare practitioners who work with the extremely vulnerable that the urgency of that work might preclude considering the arts, which you think, well, that could be more useful later down the line. But in fact, even in the most extreme situation, the arts, as you very rightly make the case, have a huge and valuable role to play in supporting vulnerable communities. Thank you so much. There are lots of questions coming in on YouTube, so we will keep them coming. I am keeping an eye out for them. We are next going to go to Lord Vaizey, who has perhaps the best Zoom background of all of us. I'm hoping it's the House of Lords, but perhaps it's your bedroom. I don't know, but it certainly is a great window behind you. Lord Vaizey, of course, was the Minister for Culture, Communications and Creative Industries from 2010 to 2016, a total of 2,255 days in that role, which is in fact the longest serving Minister of Culture since the post was created. Of course, he's also a member of the Conservative Party. He was a member of Parliament for Wantage from 2005 to 2019. But he's also a columnist, a political commentator, a former barrister. He's in part responsible for the Star Wars films being filmed in the UK. He has appeared in movies. He's supported documentaries. He's a trustee of the National Youth Theatre. And so really someone with an enormous breadth of experience about delivering not just delivering the arts, but also working on government policy and how the government can support and shape a set of institutions who are perhaps the outcome metrics are uncertain and necessarily complicated to oversee a clear policy on. So what I'm hoping that you're going to talk about now is the early efforts of the UK government to look at the evidence around the arts and what that meant to you when you were Minister of Culture and what it continues to mean to you now in all your various roles. Lord Vaizey.
Thanks very much. I'm beaming in live from my garden shed, just a little window I knocked up there. No, I'm actually calling from the House of Lords and disturbing all the other peers who are trying to work hard in the Salisbury room, but I know that they will look up as I speak, as they will be enthralled by what I'm about to talk about. And thanks for your very kind introduction. Unfortunately, I can't cook. That's one of the talents that I don't have, that Christopher Bailey has. I was delighted to meet Christopher at, I think it was some kind of Davos something summit, but it was actually held in Soho House in London. But where he told me that the British government had been a bit of an inspiration to the WHO. So I was immensely flattered, which is why I've agreed to attend every single event that Christopher ever asked me to speak at, which is why I'm here today. And Alex Coulter, who will speak later, will be much better on the detail, but I'll take, as it were, the helicopter view, which is the refuge of politicians who don't always know what they're talking about. When I was serving as the Arts Minister, not only did I have the goal to outlast Jenny Lee, who was the first Arts Minister appointed by Harold Wilson in the 1960s, but I also wanted to produce my own white paper on culture. The only other Arts Minister to do so had been Jenny Lee. And one of my goals and one of my passions as Culture Minister was to try and get out of the silos into which policy in the UK and indeed I suspect many other countries always sits. Everybody, does what they have to do. I'm trying to think of the American phrase, they stay in their lane, as it were. If you're in the education department, you're looking at schools. If you're in the justice department, you're trying to lock people up. If you're in the arts department, you're funding museums, and nobody seems to talk to each other. And there's no better vehicle for talking to each other than the arts. And one of the goals of the white paper was to say that the arts are obviously important and have intrinsic value in and of themselves, but they can be so much more than that in terms of the impact they can have on their communities. And the obvious areas, for example, would be somewhere like criminal justice. I briefly and unsuccessfully had singing lessons when I was a minister, and the lady who taught me ran a choir in a prison. And it's a stunningly obvious point to make. That you take people who are incarcerated, who are often in prison for various reasons to do with their background, and you give them, through a choir, a community. And even more importantly, when they leave prison, joining a local choir gives them a community. These are often isolated individuals without the kind of networks and bonds that we take for granted. That's a stunningly obvious point, but it's not stunningly obvious till somebody makes it. And I wanted to reach out to all these different silos and connect them. And health is another stunningly obvious area where the arts on every level makes an impact. There are numerous examples, and no doubt Alex will elaborate on some of them, but the Chelsea and Westminster Hospital, for example, in central London, has long had an arts programme where you're talking about just the art that surrounds you when you're a patient and what a difference that can make. We know that in terms of speech and language therapy and learning difficulties for young children, that the arts can help bring people out of themselves and learn to communicate better. We know that with isolation, loneliness, and depression, being part of a community organisation, often an arts-based community organisation, can make an enormous difference to your mental health. And we all know this instinctively. I know that a lot of the tone of this session has been about evidence, but we know, for example, that if you're in bed in hospital and you're looking out of the window at a beautiful view, that will have an impact on your medical outcome. All of this we know instinctively. And part of my frustration to a certain extent when looking at this was that there was quite a lot of, from the Department of Health, I have to say, quite a lot of pushing the can down the road by saying, well, actually, we need more evidence, more evaluation until we fund this. But I pressed ahead. I couldn't get any money out of the Department of Health, but I pressed ahead in my white paper with saying that the Department of Health needed a proper arts program. It was the first time anyone had said this since a Labour minister called Alan Johnson had made a speech about the arts and health about a decade before my white paper. And the trouble is, if any minister ever dares to say something like the health service should avail itself of the arts more, they often get ridiculed by the newspapers who say, if you spend money on the arts, you should be spending it on a ventilator instead. This is a terrible waste of money. It's a really, really narrow-minded, terribly backward-looking view. But we pressed ahead, but I couldn't get any money from the Department of Health, and I had no policy. So I relied on Alex Coulter, who you're going to hear from later, because I am now co-chairman of the all-party group on arts and health in Parliament, co-chaired by Alan Howarth, who ironically couldn't be here because he has a doctor's appointment. But Alan set it up, another former culture minister. And I said that the government's policy would be whatever the all-party group on arts and health decided it should be. They then, about a year later, published their version of a white paper which set out a policy. And then the ultimate hero of this story is a man called Matt Hancock, who is currently the British Health Minister fighting the pandemic. But he was before that the Culture Secretary. And he, to his great credit, took from the Department of Culture, when he moved to the Department of Health, the stuff he had learned about the impact of the arts on health. And he eventually set up, with a relatively small amount of money when you consider the size of the health budget, about £5 million, the National Academy for Social Prescribing, which is what Alex had called for in the all-party group report, a version of it. And the National Academy of Social Prescribing is the first step on what I still think will be a long journey to say, it gives kind of an official imprimatur to say that prescribing arts therapies and remedies is a perfectly legitimate medical intervention that can be a repository for the kind of research that people like Daisy and Helen have been talking about, to take that forward and can promote best practice, and I hope will grow and thrive in impact and influence over the years. But it is a little acorn, which I hope a great oak will grow. But it's really the first time anything like this has been done in the UK, as far as I'm aware, and it is a great step forward. So I hope that gives you some insight into the journey that we have started, and I hope that with the help of people like Christopher and the WHO and events like this, and more banging of the drum about the impact of arts and health, and bringing together people who know what they're talking about and have the evidence and have the examples, we will go forward. And just as a postscript, even now, for example, with obviously with COVID, you can take an organization like the English National Opera, which has been promoting its Breathe program recently, where again, people with long COVID can access the expertise of the singers at the English National Opera to undertake breathing exercises which can help them cope with long COVID. And I would also say, by the way, I know I'm rambling now, but very quickly, definitely the final thing I'm going to say, this is a sort of mutual win-win for me, because the arts, in my view, constantly have to justify their existence to politicians and their support. I think one of the silver linings from the pandemic, given the catastrophic impact it's had on the arts' ability to perform, is that a lot of arts organizations have actually got out of their own silos and gone out to their communities, whether it's the local health community or other communities, and engaged with them. And I hope that those connections, which in many cases are newly established, will continue and again promote this ongoing virtuous circle. Thank you.
That's a lovely description of the long COVID and the choir. When I went to the, I had very enduring symptoms from COVID, and when I went to the to see the respiratory physiotherapist, she was very good, but she said, "Look at you there, sitting there, breathing with your mouth open. Close your mouth." So I closed my mouth, and she said, "Well, you're making a lot of noise when you breathe." And I was like, "Well, that's because mine go through my nose." She said, you shouldn't be doing that. So the choir would have been a very good intervention. Thank you for summing that up so nicely. It is, I must say, from my point of view, it's very easy to imagine that the value of the arts just sort of manifests itself magically, and that everyone should be pretty aware of this. And in fact, your description of the anxiety as a politician having to face down the newspapers for something that actually on the face of it could sound foolish is a really lovely description, that individuals in the end do have to champion these things, and that Matt Hancock's journey from one position to another and what he learned is really interesting. I think that certainly isn't something I was aware of, and it's really good to hear that. You've made my life even easier by pretty much introducing Alex Coulter, so that's lovely. I will do a very brief formal introduction, but I think you're going to pick up very nicely from what Lord Vaizey said. Alex has been the Director of Arts and Health Southwest since 2010. She's been working in the arts and health since 1998 and was the arts coordinator at Dorset County Hospital for 15 years. She crucially provides the Secretariat for the All-Party Parliamentary Group on Arts, Health and Wellbeing on behalf of Culture, Health and Wellbeing Alliance. And she's project managed a 2-year inquiry into arts, health and wellbeing. The inquiry report, Creative Health, was launched in 2017. So really, I think you're, again, in terms of the detail and the way in which you can speak to these issues, Alex is going to talk about the new NGO that's been launched this month, the National Centre for Creative Health, and its mission, and kind of pick up on what Lord Vaizey said. So Alex, thank you so much for being here and kicking us off with that.
Thank you, Zand, and hello everyone. So yes, at the launch of the National Centre for Creative Health on the 9th of March, one of our speakers, Lucinda Jarrett, who's Artistic Director of Rosetta Life and Director of the Stroke Odysseys programme, quoted a neurologist, Dr. Phil Clatworthy, who said, "Without hope, people who have had a stroke cannot recover." Lucinda explained, hope is the unacknowledged mechanism of recovery, and the arts reach that more easily than medicine because they enable us to imagine and dream of possibilities. Before the first lockdown, I was reading Rebecca Solnit's Hope in the Dark, and from that book I had taken the thought that hope is generated by action and that activism sits between pessimism and optimism. We may be very conscious of all that is wrong, but through acting to change the world for the better, we generate hope for ourselves and others. So generating hope now joins making meaning in my vision of how art might heal. And not only heal, but enable people to flourish. To quote Grayson Perry in the Creative Health Report, art, like science and religion, helps us make meaning from our lives, and to make meaning is to make us feel better. The National Centre for Creative Health has come about because of the All-Party Parliamentary Group on Arts, Health and Wellbeing 2-year inquiry, which led to the Creative Health Report and Recommendation 1 for a National Strategic Centre. And thanks, Ed, for all your introduction to this. That inquiry lasted from 2015 to 2017. The first key message of the report, Creative Health, was that the arts can help keep us well, aid our recovery, and support longer lives better lived. It draws on more than 1,000 pieces of evidence and 200 case studies, and it follows our journey from birth to death and frames the life course within a discussion of the social determinants of health and well-being, the conditions in which we are born, grow, work, live, and age. Professor Sir Michael Marmot, whose seminal work on social determinants and health equity has influenced global health policy, said of creative health, "The mind is the gateway through which the social determinants impact upon health, and this report is about the life of the mind. It provides a substantial body of evidence showing how the arts, enriching the mind through creative and cultural activity, can mitigate the negative effects of social disadvantage. Creative health should be studied by all those commissioning services." Since the publication of Creative Health, there have been further strides in developing the evidence base, and you've heard from Daisy and Helen, who've both made such significant contributions to that, along with many others. Where the National Centre for Creative Health sees its strategic role over the next few years is in helping foster the conditions for creative health to be integral to health and social care and wider systems, enabling the spread of good practice. So we will help identify gaps in the evidence base, encourage the transfer of knowledge between research, policy and practice, and promote collaboration. Our priorities include a focus on health inequalities and inequality in access to opportunities for engagement in the arts, culture and creativity. The two things are often coincide. So we're working in partnership with NHS England and Integrated Care Systems, which are the new structures that bring together NHS, public health, local authorities and voluntary community sector organisations in 42 geographic areas. We're working with academic health science networks and universities, including University College London. And a key partner for us is the Culture, Health and Wellbeing Alliance, which has around 6,000 people, reaches about 6,000 people across England, who are arts practitioners and organisations working in the field. Also the Lived Experience Network, people who've experienced the benefits of the arts for their own health. And we're working with colleagues in Northern Ireland, Scotland and Wales. And significantly, based on what Ed was just saying, we are working with the National Academy for Social Prescribing, which is a whole other big initiative, which we could talk more about if there are questions about it. So our efforts to influence policy have always been grounded in the work of the All-Party Parliamentary Group on Arts, Health and Wellbeing. And Ed mentioned Lord Howarth of Newport, Alan Howarth, who's co-chair of the All-Party Group and chair of the National Centre for Creative Health. He's unable to be with us today, but he's here in spirit. And he has been at the forefront of developments in arts and health since his time as Minister for the Arts in the late 1990s. Through the process of the inquiry and the Creative Health Report, and in setting up the National Centre for Creative Health, we've found that there is a huge appetite for this work across the cultural sector and the health and social care worlds. The experience of the pandemic has created an even greater sense of urgency and willingness to act in collaboration. So I do feel we're surfing a kind of wave of energy. Chris spoke at our launch, and it's very exciting to be part of today's discussion and the week of events, this Healing Arts Events Week. So we very much hope to continue to work with everyone in support of the World Health Organization's programs on the front line of the response to COVID-19. And thank you very much for inviting me to be part of this conversation.
Well, thank you so much for that. And I think what's joyful about this panel is all of your ability to capture the complexity of this in a way that I think is making it accessible to anybody watching, how art might help and help heal by helping people flourish, by generating hope. It really is extraordinary work that you're doing. And you lead us very nicely on to the final panelist we're going to hear from, who is an artist himself, which is, obviously very important. Mindful of the idea of the death of the artist, it seems rather strange, Harold, to read your biography when I think your art speaks so beautifully for itself. I will introduce Harold, but what I would say first of all is he really has done absolutely phenomenal work that I think has that very rare quality of being accessible and immediately engaging, and without being populist or superficial. And in kind of looking at all the stuff you've done over the years, the thing that really stood out to me was your Serpentine Families workshop. And the various workshops you've done there, looking at families and children using their bodies as sculptural material. What could be more engaging and provocative than that? So I think, I would encourage anyone watching to go and dig up Harold's work and have a look at it. There's incredibly, it's witty, it's funny, it's very thought-provoking. Okay, all right, the bio, here we go. Harold was born in Accra in Ghana. He grew up in London. He is an artist working in a range of media, really a range of media. You see a lot of Harold's body if you are engaged in his work, but it's also video, photography, social arts practice. He studied at the Royal College of Art, And he is currently a reader in fine art at Leeds Beckett University. He's been a visiting lecturer at Goldsmith, at Slade, the Royal Academy Schools, Central St. Martin's, and the School of the Art Institute in Chicago in the USA. He's just a phenomenal guy. And so, Harold, what I'm hoping you're going to talk about now is your experience as a practicing artist working in healthcare, in mental health settings, your view from the ground. Can we see art as a health intervention? How does it feel? Does it help maybe you as an artist? And what do you get the final word before we start bringing in people's comments. What do you make of everything that everyone's said so far? Harold, over to you.
Hello, thanks, Anne, for amazing introduction. It's really great to be here, really great to be part of this panel. And thanks to all the previous panelists for their contributions. Before I sort of talk a bit more specifically, I just want to say also how great it is to not have to justify art or the production of art or really have to kind of make a case for the art, which is often, as an artist, what I feel I'm having to do is to sort of justify my own existence and the need for arts and culture within society. But so it's really great to hear the kind of evidence and the research that's being generated, really, that I think speaks to that and the need for art. I should just explain, really, I'm on the panel partly because I've been working for a number of years with an arts charity called Hospital Rooms, which was founded in 2016 by Tim A. Shaw and Neve White, who are really brilliant dynamic duo, who set up this amazing charity that works with psychiatric wards and mental health institutions, and commissions artists in partnership with health practitioners and service users to create and install works of art that really change the environment of those psychiatric wards. And I was personally involved in two projects. One was at the Royal Maudsley on the Island Skillin ward, which is a female ward. I mean, the nature of my practice is often very collaborative, although I have a background in visual arts and fine arts, performance and social engagement and social arts are really an intrinsic part of my practice. And really, for me, this idea of what art as a kind of conduit, as a means of, I think, drawing people together, creating communities, but also allowing people to articulate. I think it really resonated with me when Dévora was speaking about, the power of kind of communication in some of the works that she was citing. So as part of the commissions that I've done with Hospital Rooms, what's been really great is the way that they have facilitated these conversations and dialogues. So part of that commissioning process involves artists having the opportunity to talk to health practitioners, so clinicians, nurses, and we're able to present our work, but also to really hear about the environment in which we're being asked to respond to. And I mean, for me, this is a real kind of like example of a really innovative but generous process that allows space and respect for the knowledge that not only myself as an artist, but also the possibility of learning from, these clinicians and health practitioners, but then also as well the service users, who also their experiences, their voices. So the two projects that I did, the second one was at Croydon, at the Royal Bethlehem, on a men's only ward. Again, as part of the process, I had the opportunity to kind of visit the ward and have a tour and speak to some of the service users really about their experience. And what I decided to do in my commission, not all artists do that work with Hospital Rooms, but the work that I created came out of a series of workshops where I proposed activities where we would kind of co-make some of the outcomes. And this involved very simple activities like doing wax rubbings, which is a very traditional art technique that, you know, was a real favorite of John Ruskin, but also something that's used still in primary schools. But for me, what this allowed was a space for kind of conversation and exploration and inquiry. And one of the things that I feel is really important, and perhaps this is starting to address does art heal, is I think what comes along with an engagement with the arts for me are a number of things. One is curiosity, and a set of tools that allows one to really think about one's position within the world, to reflect on what does it mean to be a human being, to be a subject within the world, and the connections with place, people, ideas, and that reflexiveness that comes with an engagement with the arts is not something that is adjunct or a kind of luxury or something that is superficial. Again, I'm aware that particularly within the UK, there's often quite a hostile culture to the arts and culture, and just in the way that it's perceived. And I think that's because, you know, we live in quite a class-ridden society, and I think often culture is ascribed in quite problematic ways. So for me, I think I feel very strongly about this sense in which that, you know, there is for me no separation between arts, culture, and life. They're intrinsic to our experience as human beings within the world. For me, this is really central to the sense of which we can address, does the arts heal? I was really, really heartened by Dr. Fancourt talking about not only the arts in relation to therapeutics, I think, you know, but talking about prevention, and I think this is really, really kind of key. If we're talking about does the arts heal? Yes, it does. I think we've had the evidence from some of the other panelists, and as somebody that's heavily invested in arts education, I can also speak to some of those experiences within that context. But I think for me, there's something really crucial in that we must really address systemically and structurally people's engagement with the arts and access to the arts, which I think often within many kind of contexts is something that's under threat, that's something that, again, there's constantly this case that's having to be made for. And I think it's within that we must think about really kind of a holistic approach that really embeds access to the arts, and also establishes, I mean, it's really, we talked about kind of silos. I mean, it just drives me mad in terms of these weird silos in which the, you know, the arts and engineering and science is often put in these kind of weird separate spheres, when for me, again, you know, everyone, I think, is engaged in these acts of curiosity and wanting to kind of engage in the world through different methodologies, but that's something that the arts and science and engineering and these other fields of intellectual inquiry share. So I think less about these kind of sort of silos and separations. And again, I think what we've seen today across the panel is this interdisciplinary approach moving forward, I think. Okay, I'm going to stop there. Thank you.
Harold, you're brilliant. Thank you so much for ending on that lovely note of the silos, because I think that is in the questions which I'm going to try and farm out to everybody now. There is a real, you know, people want specifics, they want detail about one art form versus another, about the different categories. And yeah, I think you draw everyone's attention very nicely to the idea that ultimately it is all the process of being alive and finding meaning in our lives. I'm a very bad potter, and being a bad potter involves being a bad artist and a bad scientist. because the kiln's at the wrong temperature and the clay's at the wrong temperature and the glaze hasn't been mixed properly and all the sciencey bits, as well as not being able to make a pleasing form from the clay. So it does feel like in the end the struggles and the barriers overlap, and the silos potentially present barriers to conversations, although they do help us do the research as well. So thank you for that. Can I start then with a question? I'm trying to sort of synthesize this first of all. So we've got a question from YouTube coming from Inger Blankenberg. Apologies if I'm pronouncing anybody's name wrong, which I wanted to first of all put to Daisy and then Helen, and then I think Lord Vaizey, I'd be interested in your view as well. Are there different health benefits associated with different kinds of art? So visual arts versus music versus literature versus poetry versus dance versus theatre, choirs and so on. How do you begin to break these things down, and how do you start to make policy around them? And does the word art imply certain kinds of activity over others? Can we begin with that? Dr. Fancourt, Daisy, are you happy to kick us off?
Yes, I mean, I can answer the first part of that, which is that I think a helpful way of thinking about this is to go back to this idea of ingredients. So what is it that's similar or different about activities like singing or dancing or doing arts and crafts? Now, there are many things in those activities that are very similar. So it could be that for certain outcomes like improvements in well-being, for example, it could be that you can get the same types of benefits from each activity. And really the most important thing will be about the person who's engaging, which one they feel they've got a particular resonance with. But of course, if we're thinking about other types of outcomes, for example, if we were thinking about things that would improve physical strength or reduce frailty, then we might need to have the extra ingredient added of some kind of physical movement. So in other words, it would then be activities like dance that have that added ingredient that would start coming to the forefront as the ones that are most appropriate. So we've always got this balance between thinking what's the health outcome and what mechanisms does it need, therefore what ingredients do you have to make those mechanisms happen, but also balancing that by thinking about the person who's involved and about what things are really going to speak to them, because what we know very clearly is the more connection you feel with an arts activity, the more emotional connection in particular, and the more meaning it has for you, the more impact it's likely to have on your health.
Helen.
Yeah, I think I agree with all of Daisy's points. And I guess really it's just picking up on what Harold said, it's really about the process, and it's about the journey rather than this destination of, you producing a brilliant pot. It's about the experience, isn't it, of engaging in producing that pot. And that's why, brilliant people like Harold and that facilitation, that is they're the key parts as well of those active ingredients. I mean, certainly the fact that many arts processes, whether it's dance, whether it's singing, music making, are multisensory. So we know that's really important. So where we've got cognitive engagement, so people are doing some really deep critical cognitive thinking, they're also having an emotional experience. We hope that is positive, but it doesn't always necessarily have to be. And then another important element that Harold really talked about, that social and connective element. And when you've got all of those different ingredients, actually that's what's important, as Daisy says. But what we know is that when all of these are facilitated in a really key way, that where we're thinking about that process and that journey, and that's why I talk about the role of facilitators, and that's why it's great that Harold was able to talk about his experience of that. That's what we know is really important. As to different art forms, again, like Daisy says, we know if you're looking to, say, improve hand-eye coordination, then you're going to want to embed those sorts of critical skills. We've done a lot of work with stroke survivors and people with dementias. And so we can look to deliver specific health outcomes by ensuring, for example, that we've got more hand-eye coordination in a task. So maybe you want to do something that's more related to upper body movement. But importantly, you have to get participants engaged and enjoying that activity. So again, the role of the facilitator, I think, is really, really crucial.
So Ed, so I'm toggling between titles and first names, but we'll just, because I know some people and not others, so we'll have to manage it. But Ed, can I come to you then as a minister, as a government, then how does the government farm out the responsibilities for deciding whether art is a healthcare, one particular thing might be a healthcare intervention, but another thing the government may feel is worth supporting or encouraging in some ways is a painting in a gallery or a particular performance. Where do the portfolios then, I mean, we talked about silos. How do you divide things up between the portfolios, and how does that conversation work in government in terms of actual money and reviewing the evidence and the policy?
It is very difficult, because obviously one answer the government's come up with is the National Academy for Social Prescribing, but that sits in the silo called the Department of Health, and it's funded by the Department of Health, although obviously it will have many, many arts practitioners engaging with it. And then sitting in the silo called the Department of Culture are all the museums and arts organisations the Department of Culture funds, and funded mainly through the Arts Council. And they, to a certain extent, they put art first, as it were, but they, to a certain extent, will engage on a health agenda as well. And I think at both ends of the spectrum, you're relying on passionate and enlightened individuals. So it could be that the head of the theatre gets it and engages with the local health community in imaginative and brilliant ways. And it could be that your local GP gets it and engages with his or her local arts community in imaginative and brilliant ways. And what one needs to find is a synthesis to bring together these individuals and this practice, and begin not to provide obviously a one-size-fits-all model, but to begin to bring together what is good practice and to begin to normalize what is happening. I mean, I'm obsessed by, it slightly echoes what Harold said earlier about engineering, for example. I'm obsessed by the fact that nobody ever seems to think about anything from first principles. So when you're building a hospital, you build this sort of cube in which you're going to cut people open in, instead of thinking this is a place where people come who are very ill, and we have many tools to make them get better, including putting windows and gardens and art in this building. And similarly, we set up GP surgeries where, by and large, the practice has hitherto been when somebody comes through the door, give them lots of pills and kick them out again, instead of thinking there's an entire community outside of this surgery that can help bring this person, back to good health. So that we need a radical change of culture.
Harold, can I just pick up on that then? Because the hospitals that I do see the engineering and the design working very well are in children's hospitals around the world. But very often in a children's hospital, the entire building is in different colors. It's more beautiful, it's airy, it's light. There are installations and murals and things like this. And then for adults, we just sort of go, well, they're adults, they expect to be ill, it's fine. And you work with, you work in hospitals. You also work with families and with children. And you mentioned the wax, the wax, those sort of primary school techniques to encourage children to do art. As a child, getting out some crayons at a restaurant to amuse yourself would be fine. As an adult, somehow it's harder to dabble. How do you feel that we have a sort of prejudice towards children are meant to do art and then grown-ups are meant to do other stuff, and art is a bit siloed for the artists?
Yeah, definitely. I mean, just to answer that very simply. And I think, again, that's to do with, people's perceptions of culture and art. And I think, like I said, for me, this weird kind of false separation in that, I think a lot of people are often very intimidated by the arts. It's often to do with their experience at school, where they were told they weren't very good at music, or they weren't very good at drawing, or that sense when they might visit a kind of museum, it's seen as being very intimidating, or a gallery to kind of, and I think a lot of what I'm invested in really is kind of like really kind of breaking down those hierarchies and really recognizing that everyone is we're creative individuals. It's something that isn't separate from your daily existence, because we all engage in the arts in different ways, whether that's, the specific music we listen to, the objects that we like to have in our home. All of that is about a kind of engagement with culture and the arts. And I think the difference is that we give permission for young people to play, and kind of creativity and play is seen as a kind of pedagogical imperative that somehow you're meant to, as you go into being an adult, divest yourself of, and, you know, just go and earn money and you know, just kind of support yourself. And again, for me, it's you know, I feel a lot of the things I do are quite simple, really. It's just about allowing people to kind of facilitating this space of play that allows people to really engage with the creative potential and the reflectiveness, that sense of community that comes with engaging with the arts and well-being, of course, generally.
Yeah, thank you, Harold. There are a few. There are a couple of questions. One of them is from Anna Summers Cox, who's the editor of the Art newspaper, and she's said it would be lovely to hear case histories and the cause and effect and what was measured in terms of art and health. And I think one of the things this you've all done as a panel is kind of make a case for the richness and the importance and the amount of knowledge we still have to get. And a powerful way of doing that for the audience is to hear in sort of specific examples of perhaps practices or things you've encountered which have altered people's health and how that's been measured and what impact that's had. Would it be possible to go around the panel for each person and kind of hear a quick case study from each of you in terms of a particular example of a thing that has made a difference with arts and health? Could be good, could be big, could be small. Daisy, is it all right to start with you, and then I'm going to go around?
So a project that I was involved in about 6 years ago was a randomized control trial looking at whether singing could help mothers with postnatal depression. So the idea about a 10-week singing program. And what we discovered here was we found that indeed there was a relationship between people who were randomized into this 10-week singing program having a faster improvement in their symptoms of postnatal depression compared to people who were randomized into a control group of no intervention or a social group. So they had a sort of comparison activity, but a non-arts based one. But looking at the kind of cause and effect here, we'd obviously been able to show causality through a randomized controlled trial. But what we then did is we supplemented this with very rich qualitative data to understand more about how this actually affected people within their broader lives. And we also did a lot of work trying to understand these mechanisms. And this included studies that looked at the psychological processes. So identifying, for example, how group bonding helped the mothers as one of the ways of achieving this reduction in postnatal depression. We also did biological studies showing that things like stress hormones like cortisol decreased in the singing group more than the other activities. So another mechanism that helped to explain the cause and effect. And we also showed behaviorally that mothers who sang in the classes each week actually were better at soothing their babies, feeding them and helping them to sleep. So again, another mechanism. So we were really trying to triangulate data from lots of different scientific approaches so we could understand not just what the impact had been, but why we'd seen that impact.
Well, I hope everyone else has got a multidisciplinary triangulated scientific case study that they can sum up that quickly and that effectively. That's really good. Daisy, thank you. Helen, I'm sorry, I wouldn't want to have to follow that, but Helen, can you give us an example of you know, a part of this phenomenon of a project or a practice that you've seen that's had this kind of impact that makes the case for the arts and health?
Well, I think what I'll first start with is this is a massive challenge for, you know, essentially all aspects of non-clinical work, whether it's an intervention or otherwise. I'm part of the academic consortium supporting the new National Academy for Social Prescribing, and we're looking at exactly this. You know, what kinds of evaluation methodologies are going to work for evidencing the impact of this kind of work? And there is no easy answer. You know, the NHS have been looking at standardized clinical measures like something called the Warwick-Edinburgh Mental Wellbeing Scale, which some of you may be familiar with. There is no one size fits all, unfortunately. So I think we've got to really steer away from that. The other thing that's really come out of our work across multiple audiences, whether it's working with healthcare professionals, community workers, people within the art sectors, is there's a big resistance around trying to empirically measure the impact of this sort of work. So we all know that we need to collect that evidence base and how important that is. So I guess the approach that's worked best for us is, I can give a very specific example, which was a project we were working on with refugees and asylum seekers, both here in the UK and in a refugee camp in Jordan. And most of those individuals very, very resistant to doing any kind of more quantitative, or if you like, questionnaire-based approach to research and evidence. What they really wanted was a way to record and reflect their experiences, predominantly of PTSD, that wasn't anything to do with either their legal circumstances that they were in or their clinical condition. And so we adopted what's called a participatory action research approach. And what we essentially ended up doing was doing a showcase of the brilliant sorts of arts work that they were doing, and then inviting lots of different people, healthcare professionals, lawyers, to the event to showcase the work they were doing, so that they were their own advocates for talking about the evidence around how arts engagement was supporting them in their journey. And that, I think, but for us, we ran it at the Migration Museum, which is in South London, and it was such a brilliant event for having that sort of level of engagement for those sorts of individuals who would normally be looking at reading, for example, a WHO report. And I think just that participatory experience and participants having the ability to voice their own experiences, that's really what we're interested in, is developing, I guess, more creative arts-based research methodologies. So if anyone's got any great ideas out there, do send them to us.
Thanks, Helen. That's fantastic. Can I? We've got about 6 minutes left. So, if I can quickly, Alex, would you be happy to give us a quick example, and then Harold, I'm going to call on you to give even just a snapshot, and then I'm going to hand over to Chris to say to wrap things up. Is that all right, Alex? Have you got? I mean, don't worry if you don't, but if you've got an example, it'd be lovely to hear it.
Yes, I just wanted to raise a sort of methodology for arts and health practice, which I think is really interesting. And the example is from Gloucestershire. And one of the issues which we haven't had a time to discuss is about how these projects are funded and how they fit into the care pathways and all of the systems that the health and social care functions on. And in Gloucestershire, because it was work commissioned by the Clinical Commissioning Group, they started by asking clinicians, what is the most difficult challenge you have in your area of work, and how can we look at a creative way of approaching it? And one of those was young, well, it was mostly girls, early teenage girls, not taking their diabetes medication. And so they worked on the basis of a co-production model. So they brought the clinicians, the young people, artists, commissioners around the table to discuss what the challenges were and really look at the issues behind in this case, lack of compliance with taking medication. And they worked with circus skills, and the young people worked together and they developed a performance that they then shared with other young people in their peer groups. And it was a lot to do with issues around shame, around body image. So it wasn't really a medical issue, but it needed that co-production approach for the clinicians to understand that, and they then became completely excited about it and wanted to do circus skills themselves.
Wow. It's so interesting to hear this as someone from a clinical background, that in fact all three of the examples you've given reveal the kind of the complex mechanisms of action, and that causality, as Daisy kind of beautifully emphasized, is not enough. It's actually unpacking it is really a complicated and difficult task for the researchers. Those are three. I mean, just to have postpartum women, refugees in Jordan, and then teenagers not taking not adhering to their diabetes medicines, just wildly different possibilities for intervention. Harold, can you give us a quick snapshot, and then I'll hand to Chris.
I don't know if I can. Can you hear me?
You don't have to. No pressure.
I don't know if I can necessarily add much more beyond sort of, I mean, obviously the case study, I was talking through my involvement with hospital rooms, but I was involved in a project with Cambridge University and Geoffrey Che Biomedical Centre, where we brought together people with MS, with stem cell researchers who are looking into MS. And we got them to do an activity together, which was making a ceramic tile wall. And it was really about facilitating, again, this conversation between scientific researchers and, you know, people living who have a lived experience. And so, yeah, for me, that was a sort of tangible example. I don't have all the kind of data and evidence that others have provided, but But yeah, that's just...
We're happy. It's a beautiful example to finish with. Can I say, I'm going to hand to Chris for the last words, but can I say to Ed, to Helen, to Alex, to Dévora, Daisy, and Harold, thank you so much. Just personally, I can see the comments on YouTube. Everyone has found this such a stimulating conversation. Personally, for me, as someone on the periphery of many of these areas of concern, it's been enormously informative and valuable. And I can see in the YouTube chats people joining up and exchanging emails and making connections, which I think, Ed, you beautifully emphasized is just the key to it is individuals connecting with one another and caring and pushing an agenda forwards. I think art shouldn't have to justify itself, but this is an enormously helpful way of doing it. Chris, can I hand to you for a summing up that you'll do better than me?
Oh, thanks a lot, Zand, and thanks a lot to everyone. I learned so much. It was such a rich discussion. I'm going to try all at the same time to sum up, to give a short concrete example that you asked for, and do so in just a few minutes. And the way I'll tee it up is one of the things that Dévora touched on when she talked about the mental health strategy at WHO is this notion of community. And part of the revolution that WHO has tried to foment in mental health is to stop thinking in terms of just diagnosing people and putting them into wards or asylums, but instead of thinking about what's wrong with them, you think about what can we do to make them happy, productive members of society. Success is not identifying a condition. Success is giving people the tools and abilities to reintegrate into family, into community. It's about community. It's about reaching out. And I'll give a concrete example, which is also a teaser of the next session that begins in about 30 minutes, which I'm moderating. It's a deep dive into dementia that we're doing with our friends at the UCL School of Pharmacy. And in this story, there's a group called Elderflowers, which are a group of medical clowns up in Scotland. And the story that was told to me was this clown was assigned to go to this care home where the patients, the residents, were in an advanced state of dementia. They'd lost all concept of linear time. They often just sat in front of the television on full blast, not relating to the television, not relating to each other. And this clown arrived on Valentine's Day. And what she did was, in front of this group of fairly non-reacting people, she began to cry. And that's all she did. She just cried. And then one of the residents stood up and said, "What's wrong?" And she took out her hands and she laid them on her breast. And she said, "It's Valentine's Day and I didn't get a letter. Nobody loves me." And they all looked at each other. And this one Irishman who had literally not spoken in weeks suddenly got down on one knee, clasped his hands together, and sang an Irish ballad. There are neurological reasons why song is such a pathway to identity, to memory, to powerful emotions. And in a summing up, I'm not going to go into it, but what I will say is that in our society, we love to talk about the differences between art and science, between this person and that person, but we rarely talk about the commonalities. And one of the commonalities between medicine and art is this sense of compassion. It is struggling together. And that's what I'd like to leave everyone with, that it's not about what makes us different. It's about what makes us absolutely integrated and connected to each other, and how do we build that society towards the common good and a mutual enjoyment of this blessing that we call life. That's it.
Chris, thank you so much. Thank you to the entire panel I think you've ended us on a really lovely and thoughtful note. So thank you very, very much. Thank you all online for your questions, the World Health Organization, the Arts Newspaper, to University College London, to all the institutions that have supported this week of incredible events, and to everyone who's posed a question. Thank you very much.
Thank you.